Welcome to another episode of Med Talk. We bring various experts from medical, mental, oral health, alternative medicine, and other healthcare experts to discuss current topics and some important talk to benefit our audience to live healthier lifestyle. We have special guest Dr. Pooja Shah with us today for a follow-up discussion on current public health crisis with COVID-19. About a month ago, sometime in March, Dr. Shah provided very useful information on how is it spread, how to protect yourself, and what precautions you should take to stay healthy. Dr. Shah is an infectious disease physician currently in private practice in Edison, New Jersey, and works with her father, who is also an infectious disease doctor. So let me tell our viewers that Dr. Shah is a frontline medical provider in New Jersey, and due to her role as an infectious disease physician, she is actively involved in direct care for patients with COVID-19. Dr. Shah, welcome back to Mad Talk, and thank you for your time this afternoon.
Thank you very much for having me again.
So, Dr. Shah, welcome back. When we talked last time, more than a month ago, we were in the initial stage of virus spread in the USA. At that time, there were 128,000 cases and 4,700 deaths in the world. At that time in the US, we had 16,000 cases and 40 deaths. So the picture now is very different, as we have 2.4 million cases and 166,000 deaths in the world. In the US only, we have more than 750,000 cases, more than 760,000 cases, and 40,000 deaths. So, Dr. Shah, I'm going to start with a question. What happened and why such an increase in a short period of time?
So as you know, we know there's a lot in the news going on about the increased number of cases. I think the issue was initially not everybody was social distancing like we kept emphasizing in the beginning. And still, like everybody knows that there's still a lot unknown about the disease. Normally we thought, it's the first 2 weeks. We were worried about the incubation period, which I agree, but I see a lot of patients come in who are after 2 weeks still having symptoms. I don't know if it's because they're still carrying the virus for a long time or they're not social distancing, so they become more exposed to the virus. At this time, we also think a lot has to do that we believe there's 2 strands involved and some are more virulent than others. So we don't know how that works, but we're thinking that's playing the biggest role as well and why we're having such an increase in number of deaths in the country.
Okay. So that's good to know. So what do you see in your practice or in the hospital now, and how is that different when we talked in March?
I'm seeing a lot more patients now than back in March. It was just the beginning of this crisis. Now we're seeing so many patients coming in very, very sick. They're at the more sick stage that we're intubating, meaning we're putting them on a ventilator, a breathing machine to help them breathe. We have more and more people going to that stage at the moment when they come through our ER at the time. Everybody coming in, we have a different range. I have mild symptoms to severe symptoms, and our census in the hospital keeps increasing from when we first started a month ago till now. Right now, they're saying we're having a little bit of a slow decline, but I believe still this is still a very dangerous virus out there, and we should still continue doing the practices we keep recommending to the public.
Great. So do you have proper personal protective equipment such as gloves, gowns, respirators, and hand sanitizers? I know at one point, entire New Jersey state had crisis of PPEs and certain items for protect the staff as well as the medical providers.
So as of now, we do have supplies, but I will tell you, I have a N95 that I do reuse once a week. We do get a new one every week from the hospital. There are shortages around, but we're trying to be more conservative in how we're using our PPEs and trying to be considerate. You have to remember there's a lot of people that go into the room, not just the nurses and doctors, but we have our caretakers that are helping assisting the nurses. We have the techs that have to go in. If people need to have a certain exam, they are going to be transported. So our transport people, there's so many people that we have to protect in our hospital. So we're all working together to help assist each other so everyone's still protected as well. I am seeing a lot more healthcare workers also coming with the virus and being very sick because we're so high exposed. We're trying to take our best precaution we can to take care of everybody's loved ones that are in the hospital. But everyone needs to understand also we're doing our best to also protect ourselves as well. Because if you start losing your healthcare workers, then it's going to be hard. We won't have anybody to help protect our public.
Absolutely. Yes, yes. Thank you for keep doing the wonderful job. So, what are the biggest challenges do you have as an infectious disease physician and frontline provider in the most ghetto population in Edison, New Jersey area? Well, what are the biggest challenges do you see besides the PPE issues?
Our biggest challenge here is what treatment works. Everything is still experimental. We are finding new data coming out. Sometimes one week we might hear that this drug works and that drug works, or this combination, but then the next week we'll hear no, this combination doesn't work. So a lot of our challenges is how to save somebody. Everybody presents differently, everybody responds differently to all the treatments we have. Other thing is we also have a drug shortage going on. Like in one week we might be using a certain drug, but next week we might not even have the drug to offer to anybody. So there are a lot of challenges. We do have more options and more drug treatments, but not everybody can get the drug and treatment. So a lot of our challenges, who gets who gets what treatment, who do we give what we give, who do we intubate, who do we try. And it's a lot of tough decisions that all the providers in the hospital are making a decision. Most of the time the decisions made, our team is consisted of the primary team, a pulmonologist, and ID team. Between the three teams, we're always deciding what can we do best for all our patients. And sometimes that's our biggest challenge.
Yeah, so this is totally different than what we used to practice in before COVID-19. So it's a huge challenge. I can understand. So you talk about the treatment. So any specific treatment for the inpatient for the hospital setting, and also can you shed some light on what is plasma therapy and how is it used? I see so many messages on Facebook, people looking for plasma therapy. Can you explain what is that all about?
Yeah, so we have a few treatments. At least at our hospital, well, the hospital I work at right now at JFK, we do offer, there is an IL-6 inhibitor called tocilizumab is one option we try. We offer that. We also have, we're very lucky to have remdesivir for our intubated patients. It's an expanded access site. It's not a clinical trial. So there's a strict criteria that all the patients, they have to meet the criteria to even be considered to be enrolled. And now we have plasma. So plasma, the theory is saying that if somebody who's had COVID, survived the disease, and then they have a negative test that says that they're free of the disease, they can go ahead and donate to the local Red Cross to provide antibodies, because we believe people build antibodies to this disease. So that's your immune system telling you you can fight off this disease in the future. So we believe that we take their antibodies and put it in somebody who's very sick in the hospital. We think that will help fight off the disease for that patient personally. As of now, we are trying to get plasma here. We have done it on a couple patients already, so we're just watching to see the outcome, but it's also at a limited supply as well.
So the record patient donate like a blood donation, right?
Yeah, and
Okay.
to go to the local Red Cross. We can't guarantee we can use your blood will go directly to your loved one, but at least if you can help and donate, at least that will help all the patients we have here as well, as much as we can do. We're trying to find all the options. There's so many different things we're trying. We don't know what's working still. Some are working. Some patients tolerate the medications. Some patients don't. There's so many different things we're trying to do, but we're still also struggling to know which one really works.
Sure. Yes. So if someone develops complications from COVID-19 and goes on ventilator, what is the prognosis for those patients? Especially, what is the average time someone need to be on ventilator to get better? And what happens once they start breathing on their own? How long does it take for them to be come back to normal?
So the ventilator time varies from patients. We have noticed some patients have been on the ventilator for about, the shortest time I believe was about 5 to 6 days, and now we have people on ventilators for over 3 weeks. We don't know the time course. We don't know how long it'll take people. People might need trachs. A trach is putting the breathing tube in here instead of through the mouth. We are still in that process where we're still trying to learn how long they need to be on a ventilator. How long. I do have patients who have come off the ventilator, which has been a big news for all of us in the last week because it's bringing hope to all of us. And right now they are breathing on high flow oxygen, so we still need to give them oxygen. They're requiring high amounts, but we're hoping eventually in a few days we'll be able to come down on the oxygen. And we do actually send patients home on home oxygen if needed, only because we don't know the long-term effect on the lungs down the line. How much is the lung damage? This is something down the line, once this is all over, that all the researchers are going to look into just to get a better idea. So we're doing everything to our best ability to see how we can send a patient home, make sure it's a proper discharge, especially if they went from the ventilator to being off the ventilator to oxygen to home.
So any specific age group or any specific groups of patients are on longer time on ventilation? Any specific reason for that?
Honestly, we have a wide range of people, despite age to core, like different diseases they might have to the time. It's hard to know. But will tell you, initially when we were talking, we said it was mostly the elderly people or people with like heart disease, diabetes, lung disease. Now we're seeing everybody being affected. Doesn't matter how old you are. I mean, not as many as kids, but I'm just saying an adult population, you can be very healthy and still get this disease and not do very well. We do notice that there are certain, males are more affected than females is something we have noticed a lot here. That's something I definitely noticed in our own population, but we still see a mixed range of patients, different backgrounds, different ethnicities from all over the world. Some of them are healthy, some have only lung disease, some may have heart disease, diabetes. It's hard to say. That's why I think it goes back to, we believe, and it's not, there's still not enough data. Maybe there are two different strands and one is more virulent or more dangerous than the other, and that's why we think all different types of people are being affected.
So I know this has been going on for almost 4 or 5 weeks now, this pandemic and public health crisis in the US. How is the overall morale in the hospital, especially the frontline providers like you and the nurses and the technicians and the respiratory therapists who have been in frontline fighting this enemy for almost more than a month now? Uh, how are the things going on in the hospital?
You know, it's interesting because I've been here every day since this has started. I have not had a day off. So I tell everyone I basically live at the hospital because I'm here to help fight the fight. We have all the doctors, nurses. We've all come together it's almost like we're a family now, trying to help each other get through this pandemic. It's hard. We see so many things every day through the hospital. I always tell my friends, I wish you can see a typical day I go through every day, because it is a very big challenge for us. But I come in, I try my best. I try to save as many patients we can save. We all work together. A lot of the doctors talk to each other, try to see what's working, what's not working. The nurses also have been great support. They're the ones who go in the rooms more times in a day. So we're trying to help them too, because the more exposure to this disease, we're trying to help prevent them from getting the disease as well. So I think if anything, everyone's trying to work together to see what they can do to take care of as many people as we can in our hospital.
Yeah, hats off to you and all the nurses and all the staff. Thank you so much. So many things have changed from our initial talk and understanding as far as the necessary precautions to avoid getting the infection. What are your views and what do you suggest to your patients and our viewers? What should they do now? Is there anything different than before, or as far as not getting the virus?
I still think social distancing is important. Listen to the rules that the government has set out, especially our state government, about not going out after 8 p.m., the curfews. We need to still wear masks in public is huge. Hand washing, protecting yourself everywhere you can. Try to avoid as much as going out. I know it's hard to do that because we all need groceries and food. But really try your best to keep isolated from everybody as much as you can. In the household, if somebody's sick, try to keep them in one room to stop the spread within our own households too. We are families that, we have multiple people in the house. So, if we can try to keep our distance from each other too, because this way we can stop the spread all over. I still think that we need to keep doing that. My biggest fear is that once everything starts to get back to normal, we can have a second wave of outbreak of this virus. So even though we're like everyone's saying things are slowly getting better, I still think all this stuff we should be doing from the beginning, we still need to continue, especially the social distancing, the hand washing, wearing a face mask in public is important as well.
So you're talking about the second wave. That means sometime in fall or winter, like influenza.
I don't know when it will happen, but I'm afraid that it can happen sooner than we expect once everything starts to get back to normal. But I think we should still exercise the caution that we're doing right now, even once things get back to normal, just to prevent another wave of coronavirus.
Good advice. So, as a medical expert, how do you see the future in upcoming months as we are heading with this pandemic, and how long will it be before we see some changes and normalcy? I'm going to use the word a new normal. Maybe we're never going to be normal for next couple of years until we have the vaccination and some science available to ensure that we don't have another pandemic. What do you see in upcoming months or at 2020?
It's hard to say. I think we have a new normal in life now. I think things are going to be a big change in how we proceed with our life, especially after this virus finally leaves us. A lot of people are going to have new views. They're probably going to try to protect themselves more, is what I hope for. I think large gatherings will still be on the side of caution as well. I know I just heard that, they're trying to avoid all large gatherings till at least June, which I agree with. I honestly don't know what's going to happen in the future, but I definitely do see a change, and it's just going to be interesting to see what that change will be.
So the restrictions, you think it may go rest of the year, maybe early 2021.
It,
Social distancing, yeah.
it might go, or maybe they'll slowly open it up with us like wearing masks or trying to be more cautious, but I don't know when that will be, and I can't predict that because I think until we start to see a much decline in our cases, then
This
we'll
is
have a better idea what the next step will be. And that's why I think the governments are still pushing, social distancing till mid-May right now, which I agree with because
yes.
every day is a new day when it comes to this virus. New data comes out, new research. So we have to take it as it comes. And I think everyone needs to really, really listen to it.
So any update on the testing, both on diagnostic as well as antibody testing? What do you see in the upcoming months? Is anything is going to be changing as far as testing goes?
We still do the nasal swab to test if you have it. We do have a rapid test now, which you can get an answer within 45 minutes. Rutgers University just rolled out the saliva testing, which I think is amazing. Also, I think the antibody test also is going to be good down. It's been released this week, which will help tell people if they have immunity against this virus or not, especially if you were positive. You want to know your immunity level. Recently, I heard that in China they were having again more positive tests, people getting reinfected, but they're mild symptoms, and we believe that could be just because of the antibodies. They build immunity against the virus, but this is all still unknown to us. Everything is still in the process of being researched. There's a lot of questions still that need to be answered. So with the new testing, this could help us come with more answers down the line.
Okay, so the new testing means that are those antibody testing or those are the diagnostic testing?
The 45-minute test is the diagnostic.
Diagnostic, okay.
Antibody is a separate test as well.
Okay. Okay. So do you see any or do you give any antibody testing at your hospital?
We don't have anything in-house as of yet because this is all new. So
Okay.
I'm going to wait and see what happens. But at least we do have the rapid testing, and our testing has gotten better since we started. So if we don't have we can only do a limited number of cases every day for the rapid testing. But at least if they didn't get the rapid testing, we do get an answer at least within 24, 48 hours which it's been more 24 than 48, but at least we have better answers for a lot of the families and patients themselves.
Sure. Do you know any update on the vaccination, which is in mind for millions of people right now? And there are so many social media talk that the vaccination will be here in 2 months by this fall, this winter. What is your take on the vaccination availability?
Uh, all I know that's still in talks. I don't know how far we've come with the vaccine. I'm hoping it will be soon, but there's a lot of work when it comes into finding a vaccine for this virus, and there's still a lot of things they need to figure out about the virus first before they can come up with their vaccine. But I'm hopeful that there will be a vaccine. I just don't know when it will be.
Okay. And lastly, what is your take-home message for our viewers? Since this is our follow-up interview with you from March 12th to now, you gave a lot of good advice last time, and we were in the infancy stage at that point. Now we are full-blown, all 50 states and DC and Puerto Rico as well as Hawaii. Everyone has cases. What is your advice to our viewers? Take-home message. What should they be doing?
They should still be doing the same thing: social distancing, hand washing. Wash if you go out in public. The one thing I tell everyone when they come home: wipe down anything that you bought from the public with Lysol wipes or you know hand sanitizer. Wash everything you come, and your clothes. Take your clothes off, go home, wash them, and take a shower. Everything that comes from outside you should wash before coming into the house, just to prevent. You don't know how long if there's any COVID on these items, so it's best to be careful that way. Just to keep your safety at home, try to avoid anything you can from outside. That way, if you do, this way they're all washed and you don't have to worry, and still keep following the same thing as before, but to
Very
be
good.
more aggressive about it. Yeah.
Yes. Thank you so much, Dr. Pooja Shah, for your time and expertise. Appreciate your coming back, providing some valuable information to our viewers from your busy schedule. I wish you all the best in serving your patients and staying healthy as well. And kudos to you and your staff at JFK Hospital in Edison for doing such a wonderful job. So thank you so much and stay blessed.
Thank you so much as well for having me.